Hello, welcome everybody. I'm Dr. Eileen West, and we are here on Facebook Live today to discuss stress during the holidays. I am so excited to have a wonderful colleague and psychologist here with me by the name of Dr. Amy Hurd. Amy is a clinical
Hello.
psychologist in Vienna, Virginia. She's worked for over 20 years in a variety of medical and women's health settings. She's a strong believer in collaborative care. I love that. She specializes in helping people to cope with medical issues, chronic pain, pelvic pain, migraines, neurologic conditions, cancer, sexual dysfunction, fibromyalgia, chronic fatigue. She also works with couples to help them improve relationships through greater awareness, better communication, and deeper connection. So we are so excited to have you here with us today. And wow, stress and the holidays. It's here. It's upon us.
It is. It feels like we are getting closer. We are getting closer by the day. But I want to thank you, Dr. West, for having me here. And also thank you for putting this information out there. I think it's something that we all really need right now. I acknowledge that there are no easy answers. And so even though we have a full hour to discuss dealing with stress, we're not going to cover everything that there is to say, but I'm glad to be able to make a start. And in acknowledging, speaking about stress in general, we'll be talking about some of the stress that is unique to the holidays. But we also recognize, and you and I spoke about this the other day, that the stress of COVID is still with us all. And we're going on 2 years, almost 2 years in this altered reality, maybe a new normal. And we're also living through a second winter holiday season. We've had many other holidays throughout the last 2 years, but a second big winter holiday season that looks very different and holds a lot of uncertainty, and for many people, grief and pain. So there's the usual holiday stress that we've been feeling, I don't know, maybe centuries at this point, at least the last several decades. There's been a lot of talk about this, but it's more than that this year.
Yeah, I think so too. And when you look at the fact that here in this country alone, we've had, I think we just passed the 800,000 mark for deaths from COVID. That really reaches pretty much everybody. Everybody is going to know someone or know someone who has been hurt, who is feeling this. And so it's really important to remember to stay in touch with those people and to support them, because they may be feeling lots of grief still, especially during the holiday when that loved one isn't there. So, yeah.
That's right. Holidays are often anniversaries, they're markers for time that we spend together. And so it's really hard to, have an experience that was once a shared experience and not have it bring out that grief, be that, that bittersweet feeling of, wanting to carry on and be able to enjoy, and also the sadness and the loss and the hole that's left by the person or people who are no longer with us. And, I think I really like that you point out the individual action that we can each take, right? To remember the people around us who are struggling, to reach out to them in some way. We know, in fact, that when we are helping others, that we get benefits from that experience as well. So when we reach out, when we're there for a friend, that manages our stress also.
Mm-hmm. So I think one of the big stressors for the holiday is just the busyness of the season and the wanting to relive tradition and to the to-do list. Everybody's focusing on their to-do list. It seems like starting around Thanksgiving, things are just crazy. and we are smack in the middle of it, and holiday gatherings and connections and cards and, so I would love to hear from your perspective, and I know you have prepared a slide presentation for us to talk and go through some of the key highlighted qualities and the things that we can do to really get through this period and actually enjoy it.
That's right. Yes. And, to put it into perspective, right? As you said, there's all of this hustle bustle going. For many people, there's another layer of challenge with the changes that these past couple of years have brought, the losses. And then there's also the uncertainty, in the future. We do have vaccines, and yet the virus continues to mutate. So how do we think through all of this? I don't have all the answers, but I do have some things that will be helpful, I hope, to discuss today.
Terrific. All right. Well, why don't I go ahead and pull up your presentation, and I will duck out of the picture for a little bit, but I'm here if you need me, and look forward to getting this going.
Sure. Wonderful. Well, thank you.
And here we go.
So, Dr. West, you were mentioning the traditions and the gatherings and all of the lists that go along with this season. And I think this is sort of, the ideal. This represents some of those quintessential images that we think of, at least here in North America and, sort of the Western world, that go along with the holidays. And yet we know that it does lead to a lot of stress, although, it can bring up difficult memories. Although we have a lot of hopes about what this season might hold and the togetherness that we can create and the connections that we share, those hopes can sometimes morph into expectations, and then we end up with a lot of demands, and those demands themselves can cause a lot of stress, whether it's just because of the volume of what we are hoping to do, or because it doesn't feel like we're measuring up in some way. And I think it's also important to acknowledge that this image is not either a reality for everyone or even a goal for everyone. It's not something that is, a part of life and for all people, at least here in the US. And even seeing these types of images can bring up feelings of sadness and inadequacy for somebody who doesn't have this type of holiday experience. So we can move forward to the next slide, which just gives us information. What we'll be talking about today, as you mentioned, ways to find joy in your holidays and learn to stress less. Now, as I said, we can't possibly cover all of these skills in 1 hour, but the simple truth is that there is no way to make every stressful experience enjoyable. And so I want to talk about finding a both and, right? And to acknowledge that when we work to cope with any stress, whether it's holiday stress or COVID-related stress or other loss or challenge in our lives, that we develop skills to handle every stress that comes our way. Okay. So we use the word stress a lot in everyday language. We talk about stress as an experience that we're having. Sometimes we talk about it as a feeling. I'm feeling really stressed right now. Sometimes we're talking about a stressor, something in our lives that is causing us stress. But we want to recognize that stress at its core is a mind-body experience. And we perceive a challenge or a threat, and it may be an actual physical threat if we are, driving and need to adjust, or if we're in some type of danger, or there's, some painful sensation that shows up in our body that we need to get checked out. But our minds are very powerful. And so when we perceive stress, our body still responds. So if we're thinking back to a stressful experience from our past, and this is, common, we think about this commonly in the case of PTSD or post-traumatic stress disorder, we can be pulled back into those memories, and our body is going to respond as if that stress is happening now. And the same thing is true for future worries. If we're thinking about something going wrong, if we're thinking about how difficult it may be, for instance, to host family or to get together with family where there's conflict, then our body is going to respond here and now to that idea of what we'll be experiencing in the future. And when it comes to stress, another variable that's really important when we think about health is whether it's short or long term. So the stress response is there for a reason. It helps us literally to survive or to rise to the occasion when faced with a challenge. And so in the short term, that is a good thing. That gives us the energy we need. It's when that stress goes on for weeks or months or even years that we begin to see the impact of stress and chronically being in that stress response and how that affects our body. So we know that the body responds by activating just about every system. So our heart rate increases and our breathing increases and our immune system changes. And there are all sorts of other hormonal alterations. We sometimes even get, skin changes with, a little bit of sweating. So, all of our body is designed to get on board when we're responding to stress. But when it has to be, mounting that response over time, it can be a challenge and cause problems down the road. All right. So I often work with people who become stressed about their experience of stress. And, we talked briefly about COVID, and there has been a lot of research done on the very real stress that we are all experiencing in the context of this pandemic. For some people, it's been very personal and hit home with loss of loved ones, with loss of job or needing to change jobs, with the stresses and the demands of parenting in a very different way, or caring for sick loved ones, or not being able to care for sick loved ones, especially whenever visitation was limited to hospitals, limited to not being able to go in and see family who are in care centers. So the stress is real, and the American Psychological Association does a Stress in America survey every year. And what they found is that there are many sources of stress during the pandemic. So specifically, they found that about 70% of respondents did believe that things will work out when the pandemic is over. And about 77% were faring well overall, considering. But there were also a lot of symptoms and problems that people were reporting. So many people reported difficulty with fatigue, an increased need for emotional support. They reported trouble with decision making. And in many ways that makes sense, because a part of the challenge we're all facing is risk assessment. And so when we constantly have to make decisions about, just should I be going to the store? Should I be getting together with friends? We can reach a point of decision fatigue and overload. And there was also a lot of change in daily routines. Things like not getting up and going to work every day. That posed a problem in many ways, beyond just the challenges of having multiple people trying to work and learn in the same environment. So we're not in that same phase at this point, but we're still facing a lot of changes in what we do day to day. And some of those changes leave us in a state of social isolation, or at least more isolation than we were in before. We are less physically active because we're not getting out and about naturally as much. And that is having an impact for many people on their sleep and the quality of their sleep, and even on their diet and what they are eating. So when we think about stress, we want to acknowledge it, but we don't want to get caught in fears around that stress, because that, becomes a cycle in itself. So what we talk about, what psychologists often refer to as building resilience. And it's interesting because there was an article that was released by the New York Times that was put out on handling stress. And I'd like to just read to you the little summary that they put out over Twitter. They said, mental health has become its own pandemic during COVID, with soaring rates of anxiety, depression, and burnout. And psychologists say both resilience and the ability to grow from adversity can be cultivated. And while I do agree with that, that's what we're talking about today, I also agree with some of the responses that I saw on Twitter that felt like their experience was being minimized. People were saying, we're still in this pandemic, and so it makes it much harder to think about cultivating those skills while we're still in this day-to-day experience of fear and uncertainty. And some people even refer to that as gaslighting, right? So I want to be clear. And I talk with a lot of my patients about this because I work with people who are dealing with medical illness, and there typically is not a fix. There's not an end point. They're not going to be getting better. And there's a lot of uncertainty that goes along with that disease and how it will affect their lives. But what we want to be able to do is to focus on dealing with and acknowledging the very real struggles that they're facing, and also being able to connect with the parts of their lives that are still meaningful and that bring a sense of purpose, even when they have to do it in new and different ways. So I talk a lot about the both and in this situation, I would say we can both all still be struggling with this pandemic and the way it has affected us and continues to affect us. And we can also find ways to, bring some moments of vitality and connection into our lives, because without making that effort, we end up, again, in that same cycle where we can get overwhelmed. And we do know that that the rates of depression and anxiety are increasing. The Surgeon General recently declared a state of emergency. I don't know if that was the wording that he used, but essentially wanting to call attention to the mental health crisis among the youth in America. So, while we want to be aware of that, we also want to help each individual build skills. And hopefully, as we bring awareness to that at a broader level, to put more systems in place, because even the healthcare system is not equipped to manage the needs that we are seeing right now. So I really appreciate what Dr. West is doing to bring awareness to this. We're weaving the holidays and the coronavirus experience into how to manage stress. But right now, they're connected. All right. So when we think about managing stress, again, this is not about eliminating stress. We can't get to a point where stress has no effect on our body. As I said before, our body is going to continue to respond as long as we are facing a challenge. But instead, what we want to do is first and foremost recognize that there are times when we choose to do hard things, and that can be the source of our stress. And it can also lead to building skills that help us to deal with those challenges. So whether it's a challenge that we have chosen, and some of the holiday challenges might be something as simple, as previously as simple as, deciding to travel for the holidays, or deciding to invite friends over, and, all of the extra things that we now need to do to maintain a sense of, safety and protection for the people in our lives who are vulnerable. There may be people, and we know that, a lot of the people who have shouldered the burden of COVID are healthcare workers and other essential workers. So we also want to recognize that there are people who, whether by choice or by mandate, will be working over the holidays. And, that those are all stressors that they will need to deal with. So COVID has brought stresses like, loss, the fear, the risk, and even the division that we see in how we talk about and think about ways to protect ourselves and respond to this virus. So building skills is really a core component in being able to manage and work through stress in a way that ensures it is more workable, right? It may not be easy or desirable, but it's more workable. And when we think about that, one of the core frameworks that is helpful is to think about doing those hard things with integrity. In other words, staying true to ourselves in those difficult challenges. All right. So part of building resilience is to move from a fear of stress, again, the stress about stress, and believing that stress is only a bad thing, to developing the skills and the mindset that stress can be good. Now, there's nobody who's going to argue that what we've been through over the last 2 years is a good thing. This is not the type of stress that we can consider positive. But the idea of stress as a positive was first developed several decades ago by Hans Selye, and he coined the term eustress. And he said that type of stress can actually lead to a sense of personal initiative and productivity. And so when we're thinking about the holidays, there may be some stress that can be good. So if we decide we're going to get together with friends, and we acknowledge that comes with a lot more work at this point, that can feel good, right? We're doing something that is aligned with who we are and what we want to experience in the holiday, the connection. And the other benefits that stress can bring in those situations are providing us with more energy. Again, our body is responding. It can keep our minds focused on the task at hand. And it can also enhance our learning when we get through a difficult situation, whether it's, hosting a holiday meal, or, helping a loved one who is struggling in some way, we feel a sense of accomplishment is not maybe the best way to put it, but we can feel a sense of strength and inner fortitude by being able to weather those storms and those situations. Right. So, Dr. West, at this point, I would be happy if you'd like to come back in and we could sort of talk about let's see, I see in the chat, we've got a question. Any tips for what I can do to get myself to embrace it? It's easy to hide with that stress. And that's why, Dr. West, I thought it might be helpful. I do have 5 specific tips or strategies that we can use, recognizing again that we can't provide an exhaustive list. And also, Mona, I appreciate your question that there's no one size fits all approach to managing stress. But this first skill is really just to know yourself. So when we know and understand how we respond to stress, that can be beneficial. So for some people, they might tend to speed up. And so they're kind of always on the go. That might make it harder to sleep. I don't know, Dr. West, if you hear, a variety of complaints. For other people, they might slow down. And so they really need to work on time management and not putting too much on their plate. But I think really, understanding how your particular style of managing stress interacts with a situation is going to give you a first clue as to what might be helpful.
I think we see so many different versions of stress. When people talk with me about it in the clinic, I would say that often sleep issues are related to people just not being able to turn off the way that their mind is working. They're struggling with a to-do list. There's 1 or 2 items on it in particular that they just keep rehashing. They haven't come to a satisfactory conclusion with yet. And it literally keeps them up at night. Yes. Or they wake up in the middle of the night, and if they start thinking about it, then going back to sleep is a challenge. So
absolutely right. And we know that goes right back to how our bodies manage stress and try to do the problem solving, right? It's, I'm not going to let go of this until it's solved. But when it's not really a solvable problem or not something that they can do, take action on in the moment, then that becomes rumination, right? That becomes just the mind spinning. And so that's actually a great segue into the next strategy, which is to nourish our bodies. And, we do that in many ways, right? We're constantly sending signals to our body of care or lack of care based on what we do throughout the day. And I like to think about nourishing our body in 2 ways. There's the routines that we set up. And those routines, eating healthy food, getting enough sleep, exercising on a regular basis, they help to provide a baseline. But for the in the moment strategy, if you get in bed, in time to get your 7 or 8 hours of sleep, but your mind is spinning, what we need to do is step back and recognize that our body doesn't feel safe. And that sounds kind of strange if we're in our own bed, if we're, sort of recognizing we're at least safe enough to go to sleep and, tackle things the next day. But our body has all of these resources that are devoted to staying safe. And if we have even the perception of threat, right, going back to the idea that if we're thinking about a future worry, our body's going to respond as if it's happening here and now. What we need to do is shift out of, okay, how do I solve this problem? And think about how can I help my body calm down? How can I deactivate that part of the nervous system, the fight or flight, that literally helps with problem solving, but that is counterproductive when we're trying to find sleep or rest or ease? So there are ways that we can do that through movement, right? I think for many people, just focusing on the breath is challenging, although it's important, because when we think about the nervous system, the way that we can shift that directly is through our breath. And when we slow down our breathing and do that on a regular basis, it literally sends signals up to our brain via the vagus nerve that we are safe. And so our body can feel more of a sense of comfort and ease. So we use the breath as a way to create that sense of safety. And often, if it's difficult to just slow down and breathe, because if somebody feels very activated or very antsy, or if their mind is going, then I find movement gives one more point of focus. So I like to think of it as combining mind, body, and breath. And those three together, the mind is we focus on our breath. The body is we do the movements. And then, we're literally, taking the slow, deep breaths that help send those signals of safety back up to our brain. And it's pretty easy for anybody who's taken a yoga class or even seen a yoga class. It's possible to just do simple movements with the breath. There are some Tai Chi moves that I sometimes do with people, just bringing the arms up and then back down with the breath, bringing them open and then closed, or bringing them up over the head and then back down, and just focusing on that repetitive movement. I call it a breath flow, right? If you can create a breath flow for yourself, and by the way, you can do it with any movement. So you can do it with, moving your body around sort of in a circle. You can do it with sort of a cat-cow, so breathing in and sort of arching the back and breathing out and, exhaling. All of those are very quieting for the body as long as we stay focused, which brings us to our next skill, which is to develop a mindfulness practice. Now, at this point, most of us have probably heard of mindfulness, whether or not it's something that we've decided we're interested in or would like to experiment with. The good news is that over the last couple of decades, there has been an explosion of research on and interest in these skills. The core in mindfulness is really developing the ability to be focused and present. And so, although there's all sorts of ways of doing this, there are walking mindfulness practices, there's yoga, there's Tai Chi, there's, visualization, there's, guided meditation, there you can be mindful in any moment. But the essential element that they have been able through research, and this research is broad in that it's looked at people who have been lifelong meditators like Buddhist monks and Catholic nuns and transcendental meditators. It's looked at what's happening in their brain. It looks at before and after images for people who learn to meditate, novice meditators who use kind of a medically based mindfulness instructions to focus in the moment. But what they find is that the essential element is really to focus on something, right? The breath is the simplest thing to focus on. And then to notice when your mind wanders. And rest assured, the mind will wander. That's what it does. Our heart beats, our lungs breathe, and our mind thinks. It generates thoughts. It does many other things are happening up there in our brain, but it will never stop generating those thoughts. And so every time you notice a thought, you acknowledge it and bring awareness back to your focus. And then the mind will wander and you bring it back, and the mind will wander and you bring it back. And so for anybody who's done any exercise over time, you know that, you don't go to the gym and lift a weight and then you're done with the workout. It's the lifting of the weight over and over and over again that strengthens that muscle. And the same thing happens, it's not a perfect analogy, but that's essentially what happens in the brain when we develop our awareness and attention. And what we see in those neuroscience studies is that, in fact, the parts of the brain that are associated with emotion regulation, learning, with memory, are all enhanced, right? So there are more connections. They can actually see those changes sometimes in as little as 8 weeks. And on a positive note, they have also been able to demonstrate changes in the brain from taking just one deep, slow breath. And so, whether or not you develop a full mindfulness practice where you're sitting down and listening to a guided exercise for 10 to 20 minutes on a daily basis, this skill can benefit you. And for many of us, especially during the holidays, rather than thinking about taking on one more practice, what we can think about is being present in the moment, right? And often one of the most meaningful gifts that we can give to the people that we care about is being present with them, right? And when we do that, we are able to really listen. We're able to really engage. We're able to respond to them in ways that we don't when we're, active, whether we realize we have our own agenda or not. During the holidays, when we're clicking through those to-do lists in our head, we often are distracted or somewhere else. So we can show up in a mindful way with the people that we care about, or even with the work that we're doing. And we can also use the breathing. And the exercise that I like to recommend is that you take 5 breaths every hour. Oh, let's see. Mona is asking the question, is there a minimum amount of time I should dedicate a week in order to get those medical benefits? So the research has been on kind of a daily practice. And I think the magic number, let's say a magic number that I have read is 12 minutes. And so, that is sort of to get those benefits that they see are measurable through brain scans and even through, sort of symptom measures, right? There's a reduction in distress, there's an improvement in relationships. But when we focus on even, being present with 5 breaths every hour, that shifts what's happening in our body. And so rather than starting off, if we think about stress on a scale from 0 to 10, most of us don't wake up at a 0, at least not, at this time right now, not with COVID, not with holidays, not with so many of the other things that are on our collective plate. But, if we wake up at a 3 or a 4, and then we go through the day, and we're facing challenge, we might end up at 7, 8, 9 on that scale by the end of the day. And to get back down to a 3 or a 4 is going to take a lot of time and effort. But if throughout the day we have little release valves, then we at least have an opportunity to shift what's happening in our body's response to stress. Right? I don't know if you have had any patients ask you these questions, Dr. West, or if there's, anything that people have found to be helpful when it comes to mindfulness. I'm, in a bubble, I think, because I've been, working with this skill for so long. But I wonder what your patients find, or if this is something that they've tried or find to be helpful or challenging.
Oh, well, first of all, let me just say that the way that you're explaining this is so clear. It's really
Mm.
nice to hear it again, hear this information, but presented in a very straightforward way that makes a lot of sense to me. I think you're right. I think most people don't wake up at a 0 or a 1. They're already jumping out of bed and thinking about the things that need to happen from the moment they're semi-conscious in a lot of cases. And it just contributes to the stress. It makes it harder and harder. Um, I think mindfulness has become much more, people are much more aware of it now
Mhm.
as we've finally been starting to talk as a culture about
Mhm.
stress, particularly with COVID. But also before that, with the advent of technology and
Mhm.
the multitasking that is just so commonplace now. It's, the thought of just slowing down and focusing on one thing actually has to be intentional now.
Mhm.
Whereas, not so long ago, like, how long have we had cell phones? 11 years. Before
Yeah,
that, it was not commonplace to be doing 14 things at the same time. And
absolutely.
it does have an impact on us, and it also has an impact just on downtime. And I think, I'm fascinated by this idea that 12 minutes and little snippets. It really is
Mhm.
analogous to, an exercise. 30 minutes of moderate activity per day is what's
Yes.
recommended by the
Yes.
American Heart Association. And if it doesn't have to be all at the same time.
That's right.
So, very helpful to hear about it. And yes, my patients ask about it. In fact, I do have another patient who's interested potentially in, the opportunity to help to train people how to do some of these
Yes.
meditative practices as well, which I think would be a really nice thing for us to offer in the practice. We're going to be looking
Oh,
into that. Yeah.
absolutely. Yeah. Mindfulness-based stress reduction is probably one of the, oldest and most established formats for doing that. And that, came from the work of Herb Benson and John Kabat-Zinn at Harvard, and really their early work before the neuroscience was even there to demonstrate the benefits. But there's so many different tools and skills that are available. And I think, having that as a resource for your patients is tremendous.
I
And
think
I'm
they
glad that,
just need to learn how. They just have to, and then take the time to prioritize it. Do you need special equipment? No, not necessarily, but you do need a comfortable place to sit. That's
yes,
that's not in your bed,
that's
so
right.
that you don't fall
That's right.
asleep easily.
That's that I would say yes. And also one thing that I work with a lot of patients who have chronic pain. And
Mhm.
what I try to emphasize when they are doing any type of, mindful exercise, although the goal is not relaxation, sometimes it is helpful to be horizontal or at least sitting in a chair where they get neck support, because then they are not having to fight gravity. So for most of us, it's helpful to sit upright, in part because that does keep us awake.
Mhm.
But for people who are struggling physically, whether it's with pain or fatigue, that opportunity to, really get their body to a place where it is supported and their muscles can physically release, right? Even though the goal of mindfulness is not relaxation, doing relaxation exercise is a legitimate goal as well. It's just a separate goal. And, but it's still no equipment required. And I think that's real. And you can do it anywhere. You could be walking down the street or sitting on public transportation or driving in your car, eyes open, and doing some of these breathing exercises and shifting what's happening in your nervous system. So it's very powerful. I actually will just go back to what you mentioned with regards to technology, because there are two things that I think are relevant, especially when we think about mindfulness and the holidays. So when it comes to mindfulness, we know we have seen the attention span of Americans drop in these last 11 years, right? And as you said, that goes right back to needing to do so many things at once. We might be on an email and think, oh, I need to look that up so I can give it to them, and so we're constantly, multitasking, which we really recognize as simultasking, right? Like we can't truly be in two places at once in our brain, but we're in so many places that we're often not doing any one thing efficiently. And mindfulness is helpful for expanding our ability to focus and be present. And then the second is just the impact, and this was big in the news in the last month or so, that social media is not good for our mental health, right? There can be some benefits, but overall, if what we find is that we're scrolling through Pinterest or Instagram and we're looking at everybody else's, holiday experience, or what they are putting out there as a holiday experience, and as a result, we feel, like we are struggling in ways that nobody else is, that is not helpful. And so I am not, anti-social media, but we need to be very clear about how, the decisions that we make to use it. And hopefully there will be more clarity coming out and more willingness to self-police by the people who are on social media or who are running social media, so that some of the risks are mitigated, because it goes right back to some of the struggles we're seeing in adolescence and some of the things that people see in their own lives, that, the more time they spend on social media, sometimes the worse they end up feeling. And that goes back to, being present. And if we can be present with one another, having one meaningful interaction is going to do more for our nervous system, because there's also an interpersonal element to our neurobiology that can't be underestimated. Stress is contagious, but connection is very calming for our nervous systems. Yeah. And so, one interaction that's real is going to be, more beneficial to us than whatever we can post or see on any, electronic device. So, yeah, it's been a game changer.
I've been really struck by the fact there's a whole syndrome. It's an ADD-like syndrome that has now been recognized, which has to do with the constant activity on the cell phone. And it really does impair people's ability to stay focused and concentrate on things long term, because the way it's set up, it's short hits. It's short little hits from multiple different spaces. And that's people right. Flip back and forth between pictures and text, and between different people's accounts, and between different social media platforms. Like they'll spend 10 minutes on Instagram, and then they'll switch over to Twitter. And you really, there's so much varied, disconnected information coming at you all the time. The brain, I think, stops knowing fully how to stay focused on the topic at hand.
Yeah.
And that produces its own kind of stress.
It does. And, it's interesting that you bring it back to the brain, because I think literally what happens is there is discomfort with that lack of stimulation, right? And the way the brain sends us signals is, I'm going to make the body uncomfortable. And so, we become uncomfortable, and rather than, taking a breath or trying to get present or looking around, we end up, okay, well, that must mean I need to check something on my phone here. And that's the quickest way out of that discomfort, but it doesn't really solve the issue. So that's a great segue actually into my next tool, which is to cultivate gratitude. And, this has been talked about, just like mindfulness, it's been talked about for a long time now. It seems like maybe it's something that originated with Oprah or, some, influencer. But in fact, we have good research to show that gratitude, and, specifically focusing on 1 to 5 things that you can be truly grateful for each day begins to shift our experience. And it can be helpful for people who have depression. It can be helpful for managing difficult times, because what it does is change our filter. So our brains have a negativity bias. In other words, the negative information is like Velcro, and the positive often slips off as if it were Teflon. And so at the end of the day, if we look back and, just think, what was today like? What's going to stand out is the hurt, the disappointment, the anger, the fear. Those are the things that will, loom large in our experience. And by cultivating gratitude, we begin to put Velcro on the positives.
Mhm.
So I always am cautious to say, this is not about tricking yourself into thinking that you're not under stress or struggling, because we can't do that. That's not going to be beneficial. We don't want to minimize other people's experiences, and we don't want people to feel like they're supposed to minimize their own pain. Instead, what we do is, see if there's one thing that they truly can appreciate in their experience. So, in around the holidays, it may be that you can begin to focus on some of the things that naturally bring a sense of gratitude or enjoyment. So you can do that using the 5 senses, right? You could go for a mindful walk or a drive and look at the lights. You can notice the smells. Perhaps it's holiday baking. Perhaps it's just pine. You could go somewhere. You can. That's an easy one to create, because you can buy a candle. Buy a lotion, something that allows you to feel that in a way that is pleasant. You can use your sense of hearing. You can listen to holiday music, or watch movies, something that brings up that enjoyment. Tasting holiday foods, things that bring back potentially those happy memories. And even thinking about a favorite, symbol or decoration, and really focusing on that. One thing I find I like to do, usually after a chaotic day, whether it's been chaotic because of work or chaotic because of, family, or just, the long list, is at night to sit and look at the lights, whatever decorations I have up, whatever state they may be in. And just to let myself sort of be in that moment and feel a sense of gratitude. And even if I don't have, things exactly the way I might want, even if I don't have the tree, that would grace a magazine cover, that I can be grateful for what these things bring to my life. And I think, making sure that the gratitude is about whatever is available for you, right? It could be something as simple as an interaction with somebody at a store. It could be gratitude that you have, the ability to go to a store, or a warm place to be at night. So, cultivating gratitude is really about appreciation of the things that we do have in our lives, and creating a sense of both and, so that we can be aware of the struggle and also of the things that we can feel good about in our lives.
I love that. And I think it's so true. And I think many of us find, for those who celebrate Christmas with a tree, for example, the decorations, the process of decorating the tree, or
Yes.
pulling out the ornaments. Some of them, the same ornaments you've had for many, many years. Some of them, the
Absolutely.
ornaments that your children made when they were tiny. Some of them, they bring back so many good, places you've traveled to,
Yes.
particular events that you attended somewhere, whatever that jogs your memory and makes you think of a special relationship that you've had in the past. It is very soothing and can be a really nice thing to add to just the overall tradition. It's one of the things that I love to do when we slow down over the holidays and just soak it in and enjoy it while it's
Yeah,
there. So,
that's right.
and
Yes.
maintaining this sense of calm, I think, is so helpful when we look at our overall goals for our wellness in general.
Yes.
Stress just crosses so many different sectors of health. And if you want to really be at your best and really work well with your preventive care strategy,
Hmm.
figuring out how to manage stress is a big piece of the puzzle. You don't
Yeah,
want to be stress eating. You don't want high cortisol levels surging through your system all the time, which are, stimulating and prompting weight gain and
yes,
fatigue and lack of sleep, because all of those things will then contribute to the worsening of chronic medical condition and just
that's
conditions
right.
that make it harder to really be at your best health wise. And I love the attention that's being paid to sleep recently in the
Mm,
literature. A lot of good information in the last few years coming out about sleep and about the necessity and the value of a good night of sleep. And like,
absolutely.
yeah,
Yes,
so incorporating the relaxation and calming practices, I think,
that's
is
right.
something that's going to help all of those things. It'll just make it easier for people to achieve their healthcare goals as well. So,
Yes, and I have one final slide that fits in really nicely, because when we think about maintaining our health and managing our stress and cultivating gratitude and being present, it's really because what we want at its core is to be able to connect, right? And so relationships we can recognize, there, some of them are easy and some of them are just not. And as we're thinking about getting together with family, we want to be able to lean into those challenges and lean into the good feelings that we have, and then to the challenging and difficult feelings that show up as well. But when we are managing our stress and able to show up, it makes those connections that much richer.
yeah, the connections, really, so much of it comes back down to the connections in the end, isn't it?
That's right. That's right.
The old adage that nobody ever says on their deathbed that they wished they worked more.
No,
It's
that's right.
always the relationships. They're the most
Yes.
important thing. Yeah.
Yes. And so, when we can think about, I think for holidays, that's a positive focus, and also useful to recognize that an area of pain for many people who don't have the type of connection that they might like with their family, or don't get the kind of support that they really need. And also, to just think through what are the connections that you can lean into during this time. I love the tradition of Friendsgiving, because, it acknowledges there are so many people in our lives that we want to get together with, and that we can, create those moments with.
Terrific. Well, I love it. Thank you for all of this. Let's see. Are there more? Wait, maybe there's another one.
I think that's the
Oh,
last slide.
that's
So
it.
we're back to our holiday moment. And, I think what we want to do is just acknowledge that this is not an easy time, and each person may have a struggle that is unique to them, but there are things that we can do. And I'll just end with thinking about what we've learned from research on self-compassion. And that is, when we are struggling, we want to be able to acknowledge that for ourselves. And we want to be able to offer ourselves kindness, comfort, and compassion in that moment. And we also want to recognize that we're not alone. And what that means is, we aren't struggling because of something that we did wrong. Struggling is really part of the human condition. And whether we're struggling in, big ways with significant losses, or we're just trying to navigate another holiday season, we can know that we are not the only ones.
So beautifully said. Hear, hear. I agree.
Thank you, Dr. West. I so appreciate that you offer this service to your patients and to everybody out there on Facebook who finds us. And I'm really grateful that you were open to having me come talk about this issue today.
No, and we're very grateful that you were willing to come and join us. Love it. I really feel that any part of a really significant wellness plan for anybody, for my patients, for anyone, really has to take a look at good mental health and addressing stress and anxiety and learning these skills. Coping with anxiety is a learned skill. And that's why it's been wonderful to hear your recommendations today. Thank you.
Thanks very much, Dr.
We'll
West.
look forward, I hope, to having a chance to do this again on this topic or another one. So
absolutely, I would welcome that. And I wish everybody out there, a very happy holiday season, or actually what I would rather wish is moments of joy and peace and ease throughout that time, and all of us an easier, happier, and healthy 2022.
Yes, amazing. We're there already.
Hard to believe.
Well, thank you all for joining us. It's been a pleasure. And remember, I am in practice in Fairfax, Virginia, a concierge internal medicine practice. And if you are looking for a new physician or interested in finding somebody who's using a holistic approach, give us a call. We'd love to talk with you. All right. Wonderful. Thank you so much for joining us, Dr. Hurd, and you have a wonderful holiday. We'll talk soon.
Thank you. That sounds great. Happy holidays to you too. Bye now.
Take care now.